Guys, welcome. And I want to show you guys the brand new nursing practice questions custom quiz builder. This just released today, March 27th, 2020, inside nursing.com. Whether you're a nursing student, whether you're a pre-nursing student, whether you're preparing for NCLEX, you have this brand new, amazing custom quiz builder that is going to give you the most advanced quizzes for yourself and for exactly what you need. It's going to give you incredibly focused performance, and it's also going to give you the most advanced rationales that you can find to help you truly learn what it is that you need to learn. So let me show you how it works. First of all, you come in here, select how many questions you want, and then you get to select nursing categories. You have the ability to select 26, 12, 13, 14, 15, 16, 17 nursing categories to dive into exactly what it is you want to learn. You can see how many questions you've taken out of how many questions are in that category. And then if you just hover over here, it's going to tell you you're percent correct. We gave you this nice little performance indicator that you can see right there. Now that's the easy stuff, right? Like, of course we can do that. Of course we can see how we're doing. But let me show you where it gets even more detailed and more custom. When you pop open this advanced filters, this gives you the ability to dial in even more on what it is that you want to learn. So let's say I want to do prioritization and delegation questions. I need 75 questions, but I want to dial in by NCLEX category. NCLEX categories are set by the NCSBN, and this is what they're actually testing on you or you on when you go and take an NCLEX. So you can dial in even more. I need to take prioritization and delegation questions that are in the basic care and comfort, or maybe I just want to throw them all in there. If I want to throw them all in there, I don't even actually have to do anything. And then question type. Maybe I want to take just SATA questions. Look at this, guys. You can take just SATA questions. You can take just alternate format image type questions, or you can take multiple choice, regular, or you can just mix it up. That's what I would really suggest because that's going to give you the most realistic impact. Now here, these last two filters here give you an even more detailed ability to dial into what you want. By default, we're going to give you unanswered questions, those questions that you haven't answered yet that you now need to study. But maybe you want to go back to the ones you missed in this area and you want to get better and better and better at those. You want to understand those rationales even more and more and more, which we do suggest you do every now and then. Then you can dial into question difficulty. Maybe you're a first semester student and these high level analysis questions are just more than you're able to answer right now. No worries. You can take question difficulty 1. Maybe you're a second semester, you take question difficulty 2. Maybe you're a fourth semester and you want to challenge yourself. You want to take the hardest questions that we got as it pertains to prioritization and delegation, or you just want to get a random set here. So you go in and you start taking the quiz. After you take a quiz, you come back here to your performance and you can dial in to your global rank, how many have gotten correct and incorrect, your percent overall. You can also see your best and worst categories for nursing categories and NCLEX categories. Then you get these beautiful charts that show you very quickly and visually where you're doing well and where you're doing poorly. I have no spots where I'm doing well. Those would appear green, but for ones you haven't done any yet, it kind of hides it out so you don't get distracted by it. And the ones you're doing poorly on, we want to call that out. Look, I need to really practice my cardiac questions. I've answered 33 of them, and look, I'm only getting 15% of them correct. It's time for me to dial in, or I can dial in based on up here. What is my worst nursing category? It's ear, nose, and throat. And I'm 0%. I've answered 2, gotten 0 correct. So it's time for me to take more of that maybe, or I can come down here by NCLEX category and say, look, I'm pretty doing decent on reduction of risk potential. What we generally suggest is you're scoring anywhere from like 45 to 60%. That's going to give you a pretty good indication that you're doing pretty well. Now, once you finish a quiz, maybe you want to review it. Maybe you want to see exactly how I did on this quiz I took today, covering tegumentary, covering basic care and comfort. I want to review it. So it pops it in right here where you can review these questions with these advanced, incredibly enhanced rationales that explain why each answer option is right, why each answer option is wrong, and makes it very easy for you to read. So not these nasty, poorly formatted paragraphs or anything like that. And then I can say, okay, I got this question wrong. It looks like 50% of students are getting it right. So maybe I should be getting this right. Okay, this question is about a pressure ulcer. Check it out, pressure ulcers. You can watch a lesson video taught by these incredibly well-trained, masters prepared nurses who are practicing on the floor teach you about pressure ulcers. So you can watch this video here and learn even more. But maybe I want to learn just specifically really quickly about pressure ulcer staging. I can come in, look at this cheat sheet, and learn about pressure ulcer staging, or I could learn about different common skin scales, right? Skin breakdown, risk assessment, Braden skin score, and I can see all of that right there without ever having to leave this question. How cool is that, huh? How cool is that? And that's just as I'm reviewing this this quiz. Maybe I had to exit a quiz early. That's okay. I got this quiz right here that I didn't finish. I've taken 1 out of 10 questions. All right, I need to go finish that quiz. It's going to pop it up, and I can pick up right where I was, you guys. So maybe I spent all this time, right? Like I spent all this time building this super awesome quiz. I'm like, I really need to focus on this red area, this yellow area. I want just these ones, and I want level 3 questions. And I spent all this time building this, but then I'm not able to finish. That's okay, because I can just continue it and then come back and review it when I do finish it. All right, so that's pretty cool. Now let me take you into one. Let me show you another thing that happens here. Maybe I want 100 questions just on ethical and legal, but I want to get picky here. I want to have all SATA questions. All right, so then I go to start my quiz. And what it's going to say is, hey, we don't have there's not 100 questions with those specific parameters that you set, because you've dialed down to something that's just for you, right? It's just for John. That's okay. I can still take the 96 that there are. And so I just created this brand new quiz. So now it takes me into the quizzing platform. I got the select all that apply. And as I work through these quizzes, I get a chance to review exactly what it is that I'm learning. Okay. And you see these really detailed rationales. You see you can review lessons or case study or cheat sheets as you work through these. So you're getting the chance to dive deeper and deeper and deeper to continue to increase your understanding. All right. So I exited that quiz. No worries. It's going to save it here for me so I can come back and take it later. You can see right there. Boom. And it tells me exactly what I've added here. So I can use my performance screen to kind of see where I need to practice, then maybe review a little bit deeper on those ones I did take. But then I can build such incredibly customized quizzes that really match my needs. Now, if I'm a pre-nursing student, let me show you guys that really quick. Maybe I'm just preparing for HESI and Ts. No worries. We got you guys covered. We love you guys. We need you to get into the field. So we've given you an advanced custom builder as well. So you can really build these quizzes exactly the way you need them. All right. So we got you guys covered. So this is the brand new NPQ nursing practice questions customized quiz builder. It's going to give you the practice that you need. And with all things at nursing.com, the learning begins on submit here. When you submit that question, we've pulled in these incredible rationales with lessons taught by practicing ED and ICU nurses, with cheat sheets designed to give you exactly what it is that you need to know. All right, so this is going to help you guys. We want you to succeed. We need you to succeed, and ask for your forgiveness today. I'm in isolation as well, just like the rest of you, as we launch this product with a remote team to you guys right in the middle of the 2020 COVID-19 pandemic. We love you guys. We want you to succeed. Now go out and be your best self today. Happy nursing.